Hi, everybody. Thank you so much for joining us today. We are very excited to have Mary Webster back to talk to us about going from PDSAs to sustainability. So thank you so much for dialing in. Just to let everybody know, this webinar is being recorded and we're going to archive it on our Before and Beyond website where other IamCoin webinars are saved. Thank you so much. As a reminder to folks that's joining, we like to always kind of review what our preconception coin aim is and goal. And so our goal is to develop, implement, and disseminate a woman-centered, clinician-engaged, community-involved approach to the Well Woman Visit to improve the preconception health status of women of reproductive age, particularly low-income women and women of color. And this is Catherine Bryant doing the introduction and welcome today. Again, thank you so much. And then Mary's gonna dive in, continuing our conversation really that we started last May about PDSAs and really that transition to sustainability, and then we'll have some closing remarks. So again, thank you so much, Mary. I know that doing this quality improvement and PDSAs has been such a core part of the coin, so we're glad that you could join us and talk about going to sustainability. So Mary Webster, who many of y'all are already familiar with, she has served as our IamCoin data coach for the Preconception Coin Project for the past couple of years. She has a mastered skill set in program and curriculum development, as well as coaching improvement teams across the country. She is currently working on 2 national coins, developing a QI training for the California Department of Public Health and the Office of AIDS, and a practice-based collaborative for the children and youth with special healthcare needs medical home with the AAP. Mary remains impassioned about coaching interprofessional work teams toward improved population health outcomes. She's a registered nurse and currently a certified professional in healthcare quality. She lives in Calabash, North Carolina by the ocean, along with her husband and 2 cats with 3 adult daughters, for which she is very proud. So thank you so much, Mary. We're glad for you to be here. I'm going to turn it over to you.
Okay, well, thank you very much. Well, we have a lot to talk about today, and both of them are favorite subjects of mine, PDSAs and now sustainability. And so we have a few objectives to get to today, but please note that we could talk about sustainability for a full day or more. So we're going to cover highlights today. I'm also going to show you a tool that you can consider using with your project plans. So we'll explore current project areas, processes that are being sustained and ready for scale. And then we'd like for you to be able to identify at least 2 key factors that we'll be discussing to sustain improvement that can be incorporated into your ongoing plans. So sustainability, is it easy or hard? What do you think? Whoops. Typically it's hard. And recent studies have shown that 70% of our sustainment efforts fail. That's why it's very important for us to have a plan and a direction on where we want to go with our sustainability. Think about things in your life and in your workplace that have been sustained. What made a difference in that? What have you wished you could have sustained, but you did not? Now you see I put up here 3 typical things. We have our diets. This is the time of year where folks start to think about changes in their behaviors or lifestyles. And we can sustain fairly easy in the beginning, but without a plan and thinking how we're going to go forward and how it's going to be changed, how we're going to react to that change and those around us, we often can fail. Exercise, same thing. And then just our work, our outcomes that we work so hard to achieve. We really want to have a process that enables us to get to fulfillment. Excuse me for the water there. So remember way back in May, Catherine mentioned that we discussed PDSAs during these rapid changing times. We're in the throes of COVID and the pandemic. We had to make a lot of adaptations and pivots. We decided it was possible, though, to continue. May have to do some pivoting, but we could continue with rapid cycle testing and continue to learn from that. And I'm sure you're still doing that now. And then we thought about what was ready for scale and spread, what might be ahead for us. And we started doing readiness assessments. We talked about that. We also had a universal webinar on scale and spread that same month. So think about for your site, this could be even one part of your innovation that's heading that way. So from PDSAs to sustaining. PDSAs, if you remember, they test your theories or hunches that you may have, because that's part of the plan is you ask yourself the question and then you predict, like, how will this go? Then larger scale testing leads to implementation. So we tested under different environments, different conditions. We tested differently based on what our learning was from the previous cycle. But all of that leads to implementation. So consider what you're doing at your site now and what have you been able to sustain thus far. Now feel free to chat that in to the chat bar over there. We'd love to hear from you because we may want to come back to that. So think about even if you have sustained one or two steps in your process. Maybe it's the MA's role of asking and documenting the use of birth control for pregnancy prevention, or sharing the screening tool at the right time at the visit for applicable patients. Have your teams even talked about sustainability of this process? What does that look like? How does your agency or site sustain processes now? Can this change be hardwired? So it's really, really hard to do the other way. And how will you know if it's staying sustained? That's where we have to talk a little bit about measurement going into that next phase. I'd be remiss about going into any QI talk or QI theories without mentioning change management. So back at the beginning when I was showing you the pictures of exercise and diet and our outcomes at work, change is involved with all of that. And we react to it because we're human and we react to change because of that. So change management theory, principles, or forefront in any QI work. So there are 4 conditions though that you want to consider when you're moving towards sustainability of a change. Now, let us know how you see these things at work. A compelling story. Your staff, patients, population that you're caring for, they must see the point of the change and agree with it. So I like to talk about my example with all of these is about a year or so ago, about a year and 3 months ago, my spouse and I decided to go on keto diets for multiple reasons. And we had to come up with this compelling story to do it, you know, because it's a big deal, it's a big change. So we were looking up literature about it and reading stories of other people who did it to the point where we agreed with it and we were ready to take on that change. Role modeling. They must also see senior colleagues they admire behaving in the new way. How does that translate though for patients even? Are they seeing a consistent practice among the practitioner or one of the team members that they admire and they come see every year? Reinforcing mechanisms. Systems, processes, incentives must be in line with this new behavior. And that can be hard to do the process any other way will make it easier for it to be sustained. So incentives don't necessarily have to be financial. An incentive could also be knowing about our patients and their satisfaction with the care that we are providing. We're watching that improve over time. Or we're seeing the empowerment of the women who come in for well women care. And then capability building. The staff must have those skills to make those desired changes. So a good way to think about is, what about our yearly competency? Could we include this new process into it? Mentoring of new staff, orientation skills. So let's do a quick refresher of spread and scale, but this came from the webinar last the Universal webinar last May, and I have a reference for this on the last slide. So spread is replicating replicating an intervention. Scaling up is looking at the infrastructure behind that. Spread can also be thought of as reach. Everyone who is eligible for a particular health intervention is receiving it. So you may start with a segment of the population that's eligible and then branch out with spread. Scale, again, is often thought as replication. So that's a little different than you see up at the top there. So we have some competition here of definition. Spread is associated with horizontal diffusion. So that's your innovation going across a care pathway. Scale up, vertical, systematic, increasing coverage, range. And then one more example is spread is actively disseminating best practice and knowledge, and then implementing an intervention in every available care setting. And that's from the IHI white paper. Allergy medicine, excuse me, I have to take water sips a lot. So think about that too. You might want to consider looking at that reference if you want to get some more data and best practices around scaling and spreading. So I'm going to give you an easy definition for sustainability. When new ways of working and improved outcomes become the norm. Isn't this great? So again, I've asked you to think about the changes you've made. What protocol or processes have made you, your agency, your clinic, that much more ahead of achieving those outcomes for preconception or a well woman's visit? Sometimes I like to think about processes like confidentiality posters in the SAM rooms, alone time with your provider, new assessment questions, a standard place for documentation in the EMR, sharing knowledge during staff meetings, processes to provide patients and families with referral sites. Hold on to these changes that you're identifying, because as you think about sustainability, you'll want to come back to these changes. So, looking at this, this is just a short little example of, we had great gains here in this chart. You look at this and go, wow, we're doing really great for screening, holding the gains. And then, something's happening. You don't want this to happen over time. You want your processes to get to goal, and sustain. But even though this is just an illustration, if this was over a length of time, we wouldn't really, a longer length of time even, we'd have to grow a little concerned when we start to see maybe our processes are going awry. So what could we need to do? And then I thought about this coin, the preconception coin. How about what's sustaining within that? How about our wonderful before and beyond website? Practice guidelines, patient education resources. I know that's going to be a big focus this year. And then EMR or EHR enhancements. Those are huge. I know for those of you in the clinic settings, getting that tackled was a big project. And those can help with that hardwiring of change. So there are new ways of working. That was part of the definition. So think about, what changes have you already made to achieve those improved outcomes? Thinking back to your aim too, those outcomes you wanted, what changes have you already made? Think about your work, key aspects, things you want to sustain going forward. What metrics have you improved upon? Do you have chart data? How about qualitative data along with that quantitative data? So thinking about the previous example with that run chart, maybe there was improved, the practices around those improvements when we got there. And we say, let's say we kept that sustainability going. Those practice outcomes could be increased in screenings, assessments, documentation, referrals. What about, don't forget the knowledge, attitudes, practices, confidence of our staff, providers, state partners, and their fellow colleagues. And that could be in towards well women's care tools, screening best practices, or knowledge, gaining confidence in using QI tools that you've learned along the way. And don't forget the improvements with staff satisfaction, if you have data for that, staff and client patient satisfaction. We would want to sustain that as well. And then the other half, again, too, is around improved outcomes. So thinking about processes, outcomes, what is already improved. Even like I said before, if it's a step in your process, say you're like, we're not really there yet, but we got a step or two done, and we're holding gains with that. It's looking good. We're actually going to add a step or two to it. Keep that in mind. So this almost could be a sustainability planner recap of some of what we are going to talk about in the future slides up ahead. But just remember this, these are, take this out. This might be the one slide that you want to pull out separately. There's 7 key factors to consider here. Clarify what you are sustaining. I don't know if you remember way back, but when you created an aim statement, we often talk about just saying what you want to achieve takes some time for everybody to get to consensus and understand what you really want to do. Same with sustainability. You want to clarify so people are all on the same page. Engage your leaders. If you haven't noticed that already, it's very important for QI efforts to succeed by having leadership support. Involve your support, your frontline staff. Those doing the work improve the work. So continue to involve them in that knowledge management and the data. Communicate those benefits of the improved outcomes. Remind them of why we're doing this. Remind them of the benefits of a well woman visit where a woman's empowered to talk about the things she needs to talk about and for her future planning. Ensure the change is ready to be implemented and sustained. So you have some check marks to go through, some planning. Embed it or hardwire if possible. Those EMR enhancements can go a long way. And then build on your ongoing measurement. Maybe you're measuring quite a bit of things now and you want to pull out something specific. And we'll talk about that in a later slide. But just remember, like I said earlier, 70% of sustainability efforts fail. So it's real important to sit down and create a plan that will guide your sustainability going forward. So when we think about key factors in sustainment, we want to make it the norm, right? You know, my keto diet is the norm for us. We don't even think any other way anymore. It is our normal way of life. So we know that outcomes and protocol changes that led to our outcomes improvements. So we want to start thinking about how do we make those part of our normal business. So I'm going to show you 7 key factors that will help you with that. First one is ownership. This is number 1 for a reason. Who is going to take hold of this process? Maybe you're a big team, doesn't have to be involved anymore in the sustainability, but you do want to have someone to be the process owner, and they will oversight, monitor outcomes. They know, you know who that is if you have a question about the sustainability of that process. This person also may have to pull together a QI team again to test and implement any new ideas if needed, or if new knowledge comes in and we have to work it in. Often the owner is a manager over the program itself. Doesn't have to be though. Next is monitoring and feedback. So that's continuously looking at those outcomes to make sure if new changes that needed to be added, is all still working? Are our staff still satisfied with the process? How do our clients feel? Does the workflow still seem to be working? Leadership, again, very important. Leaders keep the focus on sustaining the new changes and outcomes. They may also be involved with keeping it in the pulse of the agency or clinic. So we're talking about it during staff meetings. Maybe it's on a dashboard. Perceived value. That's valuable to those impacted by the changes. The why. That's why we've talked about that with change management, knowing why we're doing that. It's important to communicate those changes so people do understand the why. Staff, they have skills, confidence to continually implement the new changes. So earlier we talked about thinking about competencies, orientation, peer mentoring. Organizational infrastructure. What about our internal operations that support these new changes? And lastly, funding. Sometimes we may need to find funds to ensure that something continues. Maybe it's costs for flyers or testing that has to be done. You know, we're going to talk a minute about impact, and so going back, it's like what kind of impact? If it's something that's a huge part of the ongoing process, is how do we work that in? How do we think about funding? Maybe it's something simple to pull in to talk to your leadership about for future funding, or is it something we have to go with like a foundational grant? So this is the worksheet that we have also available to you, and I'm going to change my slides here real quick and pull it up so you can see it in another view. But this is just one part of it. So hold on just a second, because I'd love you to see this.
And Mary, the link in the chat will also take folks to the worksheet.
Well, maybe that would be better. Let me go to the chat. Okay, so go ahead and pull that up, folks. Do you see it here? Because it's more than just this one page, and I want to quickly look through what we've got here. I see that, Julie. Thank you for saying that. But it looks like you're monitoring it. And that's key as you're learning right now, is that, well, at least we have some data. And when we see things dropping, you don't necessarily have to panic. You can go back and say, okay, what's going on right now in our clinic? Is there anything different? Has our staffing had to change? We all know that there's stuff going on every day right now. But go ahead and download that if you get a chance, and we can look at this a little bit closer. But it is a fillable form, so you can use it with your team. And thinking about those factors, you'll see that in C when making it a norm. And you can just check off of those things. But remember, you don't have to start with all of them, because that would be overwhelming. I'm going to go back here. You may want to think about what 3 or 4 could we focus on now. 1 or 2 of them might be fairly easy to do. And you might be able to say, well, I know we've got leadership. I know the monitoring and feedback is there. We might need to beef it up a little bit. We may have to redecide what our next measure may be if we're not going to keep the same one. And maybe it's staff. We want to work on staff because we have a few more to train. You know, we got to build that into our orientation. So if you want to, and you have a moment, think about sharing with us what 3 to 4 or even 2 of these factors ring true to you right now that you're thinking, I got to work on these 2. I need to bring this back to the team for sure. But when you're doing that, think about these 2 things. One is impact. What factors have the highest impact on sustaining our outcomes? So looking at that list, consider impact. Next, consider influence. What degree can you influence that factor? So maybe there's someone on your team that really could influence the factor of leadership because they're in that role. So when I think about the different opportunities for this, there's so many considerations. And go back to your principle of the how might we. How might we have influence with staff? How about impact? Maybe they're different ideas. And we're going to follow this webinar up, and I'm going to do a kind of a concise review of this webinar in your next newsletter. And we'll also provide this link again to the worksheet. But that's probably something I'll remember to say again, is thinking about that impact and influence. That's going to drive the key factors on how are we going to do this? How might we even get this done? So addressing those factors, you already thought about the impact and the influence. So think about what are you doing around those key factors already. Focus on your strengths right now. What are we currently doing? Are there any additional things that we are planning to do that we may need to consider in a different light now? I bet everyone on this call has something they could share about sustainability that maybe before they didn't think of it, they were doing that. Maybe you have an internal team meeting every other week or maybe monthly, and you've been sustaining that now for a while. Why is that? What were the key factors there in getting that done? So I'd be remiss not to talk about data collection during sustainment. You know, 70% of efforts failing oftentimes is that we say, you know, we've got this going on, this is great, and they stop monitoring it. And this little old principle of entropy gets involved, and we tend to go back to the way we were. So with my keto lifestyle, how do I know that it's still working? Well, there's plenty of ways for me to get data with that. There's certain things that I look for. Weight is certainly one. The way I feel physically, mentally, the foods I eat. There are a number of ways that I can monitor to see if I'm getting sustainment because I need that feedback to drive that message, to drive that change. So think about essential data you're already getting. Is there a measure that can tell you ongoing that that process is still working? How would you know? If you have 3 things that tell you that, is there possibly we could condense it or just take one of those measures? It would still tell us, because you don't want this to be a burden on someone going forward. You do want to make sure it's easily tracked. That's helpful. It gives you that good enough or keeping us on the pulse of this work. Setting a process for collection. Who's going to do it? When? Where? How? Very important. And then come up with a regular schedule for reporting that. If you were doing weekly reports, monthly reports, after longer term sustainment, you may go to quarterly. In some programs, depending on how long they've been sustaining a process, they eventually can go to a yearly statistic. I think too, it's never too late to think about future measurement. So what if telehealth sustains? If you're in a clinical situation where there's new telehealth visits, are there current measures working for that? So if you have a new intervention, say for telehealth for well calls, think about what could easily be measured. What about the voice of the customer? Could we measure that? Maybe it's not a permanent formal measure at times. Maybe it's thumbs up at the end of the call. Keeping that measurement mindset as you even move into sustainability is very important. So does it look like this? You may be asking, because right now you don't maybe not feel that way. But with a plan, it certainly can. Because you have that plan. You know who's getting that owner, who owns that process. You have leadership support. You have staff that are capable. You have someone who's feeding in that new knowledge and giving us data back to tell us whether we're still on the pulse of what we wanted to do. So we're going to have a little bit more time, and I can pull that form up and go through it, but I want to make sure I got through these slides too. So let's take a minute here to reflect and discuss, and then I can open back up the chat to see if anybody else has questions or if you want to raise your hand.
Yeah, Mary, there is one comment in the chat, a question about how do we address staff time constraints as a barrier in this model?
Well, I guess I'm thinking it's staff constraints because there's an issue of pulling somebody out of staffing to participate on a team or to collect data. That's a reality. I know that. And so that is a big decision with the team. And usually someone like a manager may have to say, okay, they're allotted this much time for that. Maybe getting creative. Is there someone in the clinic or agency that wants to do a project or needs to do a project? In some hospital settings, they have ladder projects, clinical ladder projects, and that built-in time and ability to work on these projects. But somebody has to take this role on, and you don't want it all to be in management, but getting creative sometimes helps. And then when it's streamlined, there's a process for those things. You can also get a better handle on the time that will be required. Being creative also means being mindful of how much time it really does take to do that work. Do we have to all be there at a meeting? Can we take good notes and be responsible to read them and have a way to get feedback back? Do we have a way to make sure that we're sharing knowledge in different ways? Podcasts on the desktop, lunch and learns, newsletters, poster boards. In regards back to that question, did I get to what you were asking, or do you have even more specific example? If I can look at the chat.
Yes, it got to what Latasha was asking.
It's always a challenge in healthcare, isn't it? We want to do this work. We all come to work saying, I want to do a great job today, and we do. But yet we have a system that has a lot of barriers in it, and we know that. We do. And part of our improvement work is trying to identify those barriers and see what we can do to mitigate them. And that's why we talked about those EHR enhancements. That's helping a lot. Sometimes we have to be really creative with the way we use our time as staff members, and the way we challenge the way we've met before. Maybe we need huddles to go over our QI work really fast. We're just going to have a 5-minute huddle, talk about the data this month. What changes are we looking at? How close are we to sustaining that? Are we ready to go to the third part of our innovation? We've done 1 and 2 really well now. We've got some data to support that. we're ready to, or maybe we want to expand to a few more providers now. You know, having that quick huddle, being imaginative really helps at this time, as you know. So I don't know if I have to say this too many times, but it is key. Leaders bring along others, give permission to be involved with things, maybe help with funding, keeping it on the forefront of staff, being the encourager of the work, having a structure for each. There's actually spread plans, scale plans, and sustainability plans. That will be key to your success, and you do have access to those resources, and I'll talk about that in a minute. Continue to seek feedback from your end users. We talked about that. Why is that important? Because they're doing the work. They can tell you things that maybe in your role position you'd have no way of knowing because you're not there. You're not doing that role every day. And it's great for folks to share the experiences from their different roles. Those working at the front desk, those in the back office may never cross paths or know the different things that they're seeing and experiencing with our patients. And I have to say, your PDSAs will always remain your friends. So remember, I mentioned that earlier, that you'll continue testing things even into sustainability. Measure what matters, and then note ideas to communicate and celebrate successes. Frontline staff, leadership, support staff, and your clients and families that come to visit. Here's some good references for you to look at later. And I did want to mention that the webinar 3 for this year was Spreading and Scaling Innovations. That was back on May 14th. So the slides, recording, and a resource guide are available on the platform until March 20th. So if you are interested in looking at that or seeing that, please contact Catherine, and then we'll take care of that for you and help you with that. So quickly, if do I have time to open it up? I think I do.
Yeah, we've got a good amount of time available for questions and conversation. I'm going to, Mary, we still see your screen. You're not on your slides anymore. So are you doing the sustainability? There you go. Maybe drop that bar to the right so it can look a little bit bigger. Or bar to the left, sorry. Yeah.
Yeah, I'm trying to do that. Why is it doing that?
And then just while Mary's working on that, just to invite anybody that wants to chat in any additional questions, or if you want to be unmuted. I think everybody was muted upon entry. Just let me know. It might be easier to talk through what you'd like to ask Mary about.
Please.
Get feedback. We'd love to hear from folks. I won't unexpectedly unmute everybody because that might not be ideal. You never know where somebody is in the middle of the moment. So just let me know. Let me know if you would like to be unmuted.
I can't seem to get, it's not like a PowerPoint where I can just get rid of that. I don't know, but so I'm going to try to go through this. Maybe just be the way I pulled it up. But if you see here, you have your definition here. So when you get with your group, your team, you can follow through right through the instructions here. But starting with, what are those improved outcomes? Think about it. You may have to go back in time, but write them all out. It doesn't have to be a huge outcome. It could be, well, we actually have the new form. We have the screening done. And we've actually done 100 of them so far. That's a huge outcome. We want to keep doing that. Go ahead and write those things down. And this could be agency. It doesn't have to be clinic. You can change in our office. You could change that wording. Then thinking about the new ways of working. So are there key protocol changes, process changes that you've implemented to achieve this? So think about ones that you maybe are still developing or testing. That's okay. Those are all towards your new work, new way of doing things. And then as you see, we're back on C now. That's where, this is where, yeah. So these are the factors, okay? So thinking about the 3 to 4 and putting a yes, no. So, okay, thinking about impact and influence. So all you have to do is go through here and just check, well, yes, we want to do that, or no, we're not ready to work on, you know, monitoring feedback yet. That's in the future, or maybe in next quarter. But what 3 or 4 here that we definitely know that we can impact and we have some degree of influence towards that factor. Then you actually can go through this, and this is kind of fun. You actually go through this and say, what is our plans for that? I've had groups where they do this individually and then come back together and share the way they see it. And especially under plans, maybe they want to do some idea generation that day and just write out on sticky notes and then collect them and put them together. Or somebody is the scribe and they just go around the room or ask for open feedback here. But thinking about ownership, and then you have some questions over there on the left. How might we? But see, you've got a plan here. You remember when we write goals, it's always important to have, you know, who's going to do it, when is it going to get done, and how are we going to do it? So that's all there. Perceived value, leadership, monitor and feedback, and staff. So we gave you a few little ticklers of ideas here too, but you certainly can come up with your own. It makes the most difference for you and your organization. So how might we impact or influence organizational infrastructure? Funding. So like I said, this is, you can write into it now, you can type right into it, or you can print it off, do it the old school way. So any comments from anybody about this? Do they see that this is something that could be helpful for you? Or how would you use this in your project at this point?
Mary, while people are thinking about that, I'm going to weigh in, Catherine, about what kind of pops to my mind. Just thinking about our backbone work as the preconception coin organization.
Yeah.
You know, I think that I'm really looking forward to doing something like this. And I'm thinking a lot about the resources that we've developed. And I know that we recently actually kind of just had to think about sustainability a little bit differently. All of our IamCoin webinars, we've had them archived on Before and Beyond. And we are no longer using the original platform. We're switching over to Zoom. So we had to get all of our videos downloaded, and now we have to get them all loaded back up. And just thinking about that process to sustain that resource. And I'm definitely thinking about that as we're going into patient education resource development and thinking about, you know, what's going to be our long-term strategy and trying to build that in up front. So this is really helpful for me, just like kind of all of these different points of organization to think about that. This is great. Thank you.
So if you thought about these key factors here, were there any that jumped out right away to you?
I think
you thought, wow, I want to tackle this right now?
Well, I think that one that's kind of a persistent challenge, and maybe others do or don't disagree with me, is funding, right? You know, whenever those resources are gone to support the time for folks to be dedicated and maintaining something, or even to, you know, pay for a website or what have you, how do we tackle that funding challenge? And then I think also the ownership part of it really stood out to me, because, you know, we are a multi-member team as everyone is, and just thinking about like, who's going to help us make sure that this is still going. So those two really jumped out to me right away. What I would like to kind of think a little bit more about is that monitoring and feedback. It's like, how much are these still getting used? What would we need to change, and how we would do that going forward. So those are kind of like the three key areas that are just like kind of popping to my mind right now.
And the beauty of having a team is those might be the three that you're going to focus on going forward. And then maybe, Sarah or Suzanne pick one or two others. So you can utilize your talents within your influence when you consider your key factors as well. Coming together to share ideas and making the plan, but just to get started and coming up with that, it may take all of us in our own roles and experiences that we bring to the table to decide which direction to go in. I will say that you could also, and it's really, I think a good practice to start talking about sustainability really early in your work. So this is a great time for y'all to be doing this, because this is something you can look at throughout this year and go back to. But especially like if you are in a situation where funding is an issue, so sometimes that takes time, to go and look at grants or foundation support, or is it something that can be turned into the budget? Is there a way to put it into our budget for the ongoing year? How much does it really cost? Having those discussions.
Yeah. I want to focus on the chat for just one moment as we have another comment come in. And if you want to be unmuted, I believe it's Latasha, let me know. I'll be happy to do so. But the comment is that they've been thinking about this through the lens of patient engagement in QI, and they push clinicians to have a staff lead, and the time issue comes up as a barrier, but this has been helpful. So I don't know if you have any thoughts about that comment, Mary.
Okay, so I guess you're saying you want to have clinicians to be a lead in the project work, and it's their time, or to designate another staff person. I'm not quite sure, but I'm thinking you're thinking the clinician to be involved.
It says that they push clinicians to have a staff lead, and the time issue comes up as a barrier. So maybe staff time is is how I'm interpreting it. That might be incorrect. But this is thinking about patient engagement in QI. So maybe having a staff person who kind of owns that part of the process. I'm not certain though. And again, Latasha, if you'd like to be unmuted, or maybe you already unmuted.
Can you hear
yourself.
me?
Yes. Hi.
Yeah.
So I have kids around, that's why I was muted. But trying to have a staff liaison be a part of the patient engagement work has been a challenge, and time is usually the reason why that falls through the cracks. And so this has been helpful because this is a part of all QI work, and applying this to patient engagement is one of the missing pieces. But being creative and finding ways to have that work be taken care of by a lead is what I was trying to emphasize is from a patient engagement standpoint, how leads can incorporate that into their role.
And I will encourage you too to think about that change management we talked about earlier, and that do we need to circle back to the why? Time will always be all of our first excuse not to do something. We are, and I recognize that's true. We are all very busy. And so it's the traditional thought of, okay, one more thing to do, I can't do it. So that's, a normal reaction to change. We kind of go, can't do it. So, yeah. So there's a lot of psychology involved in QI work, but, there's a lot of change involved. So thinking about, well, how might you do that? Maybe it's, could we have some quotes from you? Maybe we could get a little 5-minute video of you talking about why this project is important to patients. And, I don't know what the staff liaison would need to do, but, coming up with, asking them what would make it possible for you to be involved. Let me tell you about what the commitment would be, and the why, and how you are helpful for this initiative. Sometimes that's all that's really needed, to have folks step back and go, okay, well, that's not as bad as I thought. I thought I'd be going to meetings every week and I have to do this. And if that's the case, can we look back at that and say, do we need the clinician to do all of that? what do we really need that person to do? You know, what's the most bang for our buck, if you will, when they're thinking about, okay, I've got maybe 30 minutes a month. Okay, what can we do? Because it's very important to have this role. And as they get engaged with it and they work their processes out around that work, you may get more time available. And thinking back on those incentives too, it may not be a financial incentive for that person to be involved, but there could be incentives of them seeing patients engaged and what that means to that visit with that patient. You know, they're actually coming with questions. They're armed with knowledge that's helpful for that interaction. Yeah, you're welcome. Totally welcome. Love the comments, because I hear that all the time. You're not alone. And, you know, right now, you know, somebody had said on a webinar was not long ago, they said, Mary Webster probably would not recommend starting a QI project in a pandemic. And and I was like, well, I thought about that. And I thought, well, you know, we never start them in completely smooth waters like that picture I had on the slide. You know, there's always something going on in there. So that's where QI principles are really handy, though, if we're, you know, really using them. You know, we're practicing what we preach, and we're utilizing each of our team members appropriately and respectful of those times. And I love that you're looking at it through patient engagement eyes. You know, our patients can really help drive our improvements. They tell us what's going on. We get foggy lenses sometimes when we're there doing the work all the time. We don't see the things they do, and maybe we need to hear that. And they also can come up with great ideas for improvement because they've been dealing with it. That's why I always say, you know, don't forget that front desk person, the janitor. You know, all those folks may be seeing things that we as a team may not, you know, depending on what our roles are. Great question and comment. Anybody else?
That's great. Thanks, Mary. Yeah, folks, we still have just a few more minutes. So if you want to unmute and ask Mary a question or pop anything in the chat, please do.
If you don't, go back to the slides.
Yeah, that'd be great. I think that the one thing that I think might be helpful, if you have any thoughts on this, is, you know, if that momentum has declined, if you will, like how do you pick it back up? Like what's like a great tool for getting people to restart once they've seen that big slip when they're trying to sustain?
Well, in a short answer, I'm gonna have to give you a lot of ideas because, you know, if I knew the whole scenario of the journey, to say more. But think about what have we done so far? And then you may say, well, it doesn't seem to be working now. So if you haven't been doing communications with the staff, like I love break rooms. I think they're underutilized. Maybe we need to amp up the knowledge. Maybe we need a better why statement. Maybe we need to find something to celebrate. You know, we didn't think it was that big a deal, but, you know, it really is a big deal that the MAs have been asking this question now for 30 days straight in a row and feedback, and that's just awesome. Maybe we need to, my earbuds just died. You know, those are, you know, having data. Have we not? Maybe we need to come up with a quick data extraction that we could just see. That I know we tested this with 16 patients over the last month. Guess what? I went back and looked, and more than half of them had everything on it that we wanted. That was wonderful. You're not saying only 49% were done. Look at the positives of it, because you maybe need that now when the morale is low. Is there a patient quote anywhere that you have that you've gotten before that you could pull out and leave the staff meeting with that? Is there new knowledge that's real exciting or upcoming that supports that work that you would want to share? Maybe there's things from your team meeting notes that haven't been talked about that were kind of cool. When momentum is lagging, that's when you really got to say, we got to pull some stuff out that's going to excite and engage and remind people of the why we're doing this. We can easily forget when stress is upon us. And that why is really important to bring it back. If you don't have data, I encourage you to get something. Qualitative data can be very helpful. Maybe it's a fun little art project you put together in the break room. I know that means somebody's going to have to put some time into it, but I'm sure your work around this project is very important to your team, and you've worked hard and long on it, and you can divvy up little ideas of things to pull it out. Maybe ask a key person in the agency or clinic to speak about it at a staff meeting. Maybe we haven't done that in a while. Maybe why it's important, or how it's making a difference.
That's all so helpful, Mary. Thank you. I appreciate those recommendations. So it's hard to believe that almost an hour has already flown by. Lauren, to see your comment in here, a shameless plug for Maintaining Momentum Tips and Tricks webinar that the data team did a couple of years ago. And that would also be available on the IamCoin web platform. If you have any trouble accessing that, just let us know. In the chat and on this slide are also for feedback survey if you have a moment. And then also please do connect with us on our social media. Mary mentioned that there will be a newsletter coming out next month, and we're going to have some additional resources related to this webinar in that. So if you're not receiving those, please do let us know. And they are all archived on beforeandbeyond.org. So with that, unless there's any additional questions or comments, I just want to say thank you everybody for joining us. Special thank you, Mary, to you for putting the time and energy into this webinar. I hope that it was helpful for folks. And if you have follow-up questions, do let us know. Be happy to loop back with folks. We have the ability to reach to Mary for support on this project for a little while longer. So we're really excited about that.
Yeah, please do. And I'd love to hear about what you guys are doing.
Yeah. Okay. And with that, we'll go ahead and stop recording. And thanks, everyone.